Hello, good afternoon, good evening, everyone, and thank you for joining us again. My name is Mieda. I'm the co-moderator for this call. Unfortunately, my moderator, Ms. Tony Agbaje, isn't able to connect with us now due to some issues with our audio, but hopefully she will join us in a bit. Today, we have a very special sort of meeting, I guess, with the Heroic Alopecia Foundation and also with the Asido Mental Health Foundation. So today we have with us Miss Jasmine Ogunbodede.
Hi.
Hi,
Yeah, right.
how are you doing, ma?
Very well, thank you. How about you?
Awesome. I'm doing okay. So
Okay.
we'll just to start the meeting, we'll just have Miss Jasmine introduce herself and then tell us a bit of her journey with alopecia and how she came about starting the foundation. Over to you, Miss Jasmine.
Okay, thank you. Thank you for this privilege. My name is Jasmine Tolulope Ogunbodede. I'm a creative artist and the founder of Heroic Alopecian Foundation. I started losing my hair sometime in 2004. I think around this time in 2004. And back then, I didn't know what it was. It started with just one patch. I went to make my hair at the salon and the stylist noticed the patch. But then I didn't pay so much attention to it because I thought it was a minor thing because I used to have a very long hair and very good hair at that. So I felt, okay, it's a minor thing and my hair was going to grow back. Then I think 2 weeks after, I went back to make my hair and then she noticed another patch. So I became worried. I had to go back home because then I was in my first year in school. So I had to go back home. I showed my mom. She also thought it was a minor thing. That was how I started noticing more patches. And before I knew it, the patches started joining together like a map. And it became a big issue because at that point, I couldn't, which is I started making my hair myself, I had to spend hours and days to make my hair. So along the line, I discovered that the hair wasn't really growing. There was no improvement. And that was how I was advised in 2005, almost a year after, to take off my hair. So I took off the entire hair, and that was the last time I saw my hair. The hair stopped growing. It was growing in patches, but it wasn't meaningful, you get. So it became a problem because I became worried. And because I've never seen that kind of case before, every other person thought it was a spiritual problem. And you know how people react to things in this part of the world. So it
Yeah.
became a big issue. They started taking me to churches, and then unfortunately for me, the regular doctors didn't know what it was. So it was a bigger problem. And um, along the line, we met with fake pastors, I would say, because obviously they didn't see anything, but they kept saying the hair was under the ocean, they extorted my parents, collecting money from them because they gave an assurance that they could restore the hair. But nothing happened eventually. And in between, I had different experiences with my relationship. I had ugly experiences with amongst friends. I had terrible experiences because back then in school, there would always be someone who would call me names or try to take off my scarf or my wig just to make fun of me. There was a particular classmate I had back then who would always call me an alien, and other kind of names. Some people even called me a witch. That it's a repercussion of what the wickedness that I've done or whatever it is I've done to other people. It's a repercussion that is turning back against me. So I went through a lot. I became suicidal at some point. Depression set in, and it was really a traumatic period for me until 2015 when I decided to do a personal research, and I discovered that I was not alone in the struggle. I discovered other people around the world who also suffer from the same condition. I got to know that it has a name, and it's alopecia. And that moment, I pulled a bit of strength. I read through other people's stories of how they've been isolated, how some people lost their lives, and all that. And I decided I was going to be a source of strength for other people, and that was how I came up with Heroic Alopecian Foundation in 2015. And since then, I've been doing my best to reach out to people via social media. And that was how we started having members. The first member we got was Moshudat. I think she's online as well. She stays in Ogun State.
Yeah.
Her parents live in Ogun State. Then she was living with her parents. And, the excitement of getting to know that there's someone in Nigeria who also has the same condition. I traveled all the way from Kaduna to Ogun State to meet with her. And then she became the second member of half. And I was able to tell my story online. Other people connected. Because of the wide range of publicity we got this September, we're now over 50. And I remember crying out at DRL last week that I needed help, because some of our members were losing it. It started with one member. She came online, she sent a video of us crying, and it became a problem for me personally because I always like to see people around me living well and happy. So I could not control my fears. I had to reach out to people, I had to call people to help if there's a way we can get a mental health therapist or someone who could educate us more on mental wellness.
Yeah, I mean that's a hell of a story you've got, Miss Jasmine. But one thing that always struck me about the name of your foundation was the fact that it was named the Heroic Alopecian Foundation.
Yes, that name actually, I don't know, I can't really say that it's a specific thing that inspired that name. But then looking at my story,
Yeah,
I tried to cut the whole thing short, but the thing is I've gone through a lot. When I say a lot, I've been through a lot. When life has thrown a lot at you and you can't even start explaining the whole story. Like you can't really describe the whole story. When you are going through something and it's just you who understand what you are going through, you can't even explain. You don't even have the right words to explain to people that this is exactly how I feel. Or even when you try so hard to
yeah,
explain to people that this is how you feel, they don't just get it. And then for me to live that kind of life for 10 good years, and then all of a sudden I became strong. I just feel it's something to celebrate. You get,
yeah.
and
It actually
that's
is.
where the name that's where the name came from. Everything that I've been through inspired that name,
Yeah, yeah.
because I know some have had alopecia for so many years, but they're still finding it difficult to snap out of. They're still finding it difficult to come out.
Mm,
We have a new member who just joined, and she said she's not sure she can ever come out for people to see
see her.
or to know her with the condition you get, and she's been through it for over 15 years as well. So that's where the name came out from. It's actually a journey, like you said, and some of our members are still going through that journey. It's a gradual process. Some have passed through it and they are already strong. But no matter how strong you are, sometimes you just go through some things, like some memories just flowing, and you feel down, you get. But the ability to get up again is a big deal.
Remain positive. Yes, Remaining positive is key. And I actually even had a question about because what you said is referring to something you said earlier about reaching to pastors, like in our country where so many things are based off of superstition and what's like tradition and all. How did you get through those years, like the 10 years, even that you developed your self-confidence? How did you go about that?
Okay, the thing is, if you're telling me that there's a spiritual problem or something is wrong with me and it's spiritual, and you suggest that I do this, do this, do that, I
Yeah,
expect that a solution should spring forth. You get, but
yeah.
in a situation whereby you've tried everything, you tried all sorts, even the weirdest things, and you'd be like, if I could do this that someone wouldn't do on a regular, and this
And
whole
yeah,
thing is not working, it's common sense. Common sense to just tell you that this thing is not what it is. You get, and then we have internet at this age. Somebody should not be deceiving you that something is spiritual when you could actually do your own research and get
find it
to
out
find out
yourself.
what the problem is. Yes. Actually, way back, we didn't really have the access to internet to be able to find out what the actual problem was. But as time passed and all that, I'm glad that internet came into existence and
So thank
we're
God for
able
technology.
to, yes, we're able to do our own personal research. Because I noticed that even medical practitioners, especially dermatologists, they really don't pay much attention to it, or probably because they already know that there's no cure for this thing. They just feel, okay, let's let it slide, because to a large extent they don't help either.
Mm. True that.
Because I got an encounter with a dermatologist who exposed my scalp to disinfectants. Was using Izal. Yes, it was using Izal to wash my scalp on a regular, and he placed me on one drug like that even has nothing to do with hair growth, because I later did my research on that particular drug. It has nothing to do with hair growth. And then he placed me on an overdose. That affected me mentally because I noticed I was losing my memory at some point. Like my memory was diminishing, and it was almost leading to bipolar as well, which was very crazy. I became really aggressive. I became touchy, you know. So I've actually been through a lot. And then these pastors too were not even relating with me on that ground. So I just knew that the whole thing was false. But then if they don't see false prophecy, how would they make money?
Mm.
Because obviously they are just about the money. You get, I'm a realistic person. I'm a blunt person. If you're saying, okay, this is it. Somebody took my hair to the river or something, you should be able to tell me that, okay, this is the reason this person took your hair to the river. Okay, this is what the person needs for your hair to be restored. You get.
Yeah.
I just think it should be that practical, but then they just keep saying all sorts, going from one, I don't know. It's actually annoying, but then I knew it was false.
It must have been a great relief to have a name to that helmet. I mean,
Yes, actually.
yeah, that's cool. I remember telling my mom we live in a country where if someone has a mental health issue, they will prefer to take the person for deliverance rather than
Deliverance.
to a psychiatrist or to a therapist. Yeah, so
Yeah.
yes, I can see we have with us Miss Adetoun Faloye. She's the deputy director for the Asido Mental Health Foundation, and then she's in charge of the women's mental health.
Right. Good afternoon, everyone. Glad
Good
to
Good
be
afternoon.
here.
afternoon.
Yes, yes, we're glad to have you. Hope you're doing fine today.
I am fine, thank you. And you?
Yes, I'm all right. I'm all right. And yes, Miss
Hello,
Agbaji has also joined.
tell me. I'm
Hello,
on.
ma.
Yes.
Yes,
I
yes,
have to
finally.
find. Hello, I'm on. Can you hear me now?
Yes, we can.
Yeah.
Very
I'm
well.
I'm sorry, everybody. technology decided to play a fast one on me, and I actually had to discard my previous account and sign in with a different account.
Wow.
Wow.
So, we've listened to Tolu's interesting story and the many different dimensions of what she's passed through in her journey so far, living with alopecia. And I was wondering what your perspective was as a psychiatrist and a professional in mental health, particularly with your interest in women's mental health issues. So I was wondering, what do you think are the things that women, dealing with alopecia might be going through in terms of mental and emotional stress associated with, living with a condition that might, maybe ostracize them in society. There are situations like that. We know that there are different causes of alopecia, and there are different variants of it. I wonder if you could share your professional perspective, on and shed more light on these issues and how we may maintain mental wellness, in spite of challenging circumstances we might be dealing with. Thank you.
Okay, thank you very much. I would like to say good afternoon to everyone once again. I'd like to appreciate my boss in the person of Dr. Jibril Abdul Malik, who is the founder and CEO of the Asido Foundation, where I am Deputy Director, Women's Mental Health. I would also like to appreciate DIL Global for this initiative to have this conversation. I'm particularly glad that more and more people are having open conversations about mental health in different fora. I think that this year, this session should be my 70th conversation online and on radio stations, Instagram Live combined, even physical meetings, talking about mental health. So the truth is the conversation is getting louder. We are becoming more mentally aware.
Yes.
Let me put it that way.
Wow.
Well, interestingly, I have a bit of alopecia myself. I think I've had it. It's not complete. It's not total. It's just focal. I've had it for about, for more than 3 or 4 years. I must say, I never really paid attention, interestingly, until last year when I just asked one of my dermatology colleagues to please take a look what's happening to my hair. Okay, so when I got this invite, I decided to speak with my dermatology colleague about, okay, so what's your experience with individuals, with females who have alopecia? How do they respond? How do they react? That I've searched online and I realized that very few studies have been conducted in Nigeria about the mental health consequences of skin disorders generally. Very few, I think I found just about 3 or 4. The earliest of them, the most recent being a 2009 study, for you to know how very little attention is paid to the mental health effects of that. And her response was very interesting. She said, do you know what? I'm not sure you'll get anything, because a lot of the women who come to us, I work in the University College Hospital, by the way. There are a lot of the women, that's in Ibadan here, that's supposed to be the largest teaching hospital in Nigeria, right? There are a lot of the women who come to us don't seem bothered by the fact that they have alopecia. That I have had one time too many women who will just remove their wigs. And that even she, as a dermatologist, is shocked that, are you kidding me? You have this extensive alopecia? I said, it's not a problem. I just use my wig. And I'm like, really? So what does that tell me? Just like every other thing, the way issues affect us honestly differs. The way we respond to issues differ. And I think that for women, because we are particular about our skin, our hair, those are like defining factors for beauty, generally speaking. So when you begin to lose your hair, I would expect that that's going to have some influence on your self-esteem, possibly. It's going to have some influence on how you feel about yourself, your happiness, and your sense of worth, and how you see that you would appeal to the other gender, which are, acceptability by members of the society. Unfortunately, because a lot of the alopecia that people commonly experience that give them mental health challenges are usually irreversible. That's the honest truth. They are hardly treatable. You can hardly recover the air. So that adds another layer of challenge to the problem. So you go to a doctor hoping that you will get a positive response, and you're not getting it. Sometimes you don't even get empathy from the healthcare provider. When people have to deal with conditions that are not short duration, like malaria, when they have to deal with conditions that are going to last for a long time, from months to years, and possibly conditions that you can't have a cure for, that has to be managed, quote and unquote, it is usually very tough for a lot of people. And because it is something you have to deal with day in, day out, it increases the chances of mental health problems. Now, these mental health problems may not necessarily be mental disorders. And it does not mean that it is inconsequential, even though it is not a mental disorder. People may not necessarily have full-blown depression. They may not necessarily have full-blown bipolar. They may not necessarily have full-blown mental health conditions. But whatever it is they even feel, as simple as poor self-esteem, it is worth paying attention to. And like I said, for females, the hair, until very recently when wigs became popular. Imagine before wigs became popular and you have to just go. I know what I had to do. I bought different kinds of creams that everybody said was going to help. I have done that. Trying to get a solution is sufficient distress in and of itself, because it raises your hope when you get one that somebody tells you would work, and then you try it and it doesn't work. It introduces hopelessness afterwards. And those are mental health consequences of dealing with stuff like this. The added challenge again is that when you then go to physicians, because they don't even pay attention to the emotional distress or disorder that you may have as a consequence of that, they may say the wrong kind of words, they may do the wrong kinds of things, and that complicates the matter. And then go to the spiritual angle. I heard some of the things people said to her, some of the things pastors said to Miss Jasmine. Those were not kind words. Those things can perpetuate mental health conditions. Imagine being told that it's because you are a witch, or because there's one here under the ocean somewhere in is the Atlantic Ocean or wherever. How do you expect a lady to feel that her hair is under the ocean? I don't know where people get all of that kind of stuff from, and that's sufficient demoralization for any human being. So to be honest, I look through the books, I look through the literature. People have recorded frank depression, suicidal thoughts. Some people have even actually had outright suicidal attempts from this. Some people have anxiety disorders or just deal with frequent anxiety symptoms, and then every other thing that shows up in their body, there's the tendency to want to link it to, is it this alopecia? Every other thing that happens in their lives, there's a tendency to want to link it to their alopecia. So imagine having to live in a perpetual state of fear and apprehension as a human being. And then finally, the stigma that accompanies this kind of thing. Imagine being treated differently, being isolated, being discriminated against. Those are not experiences that any human being should go through by other human beings. Sometimes it's even family members that inflict some of these discriminatory acts. So we can't continue to ignore these issues and behave like they don't exist, because they do, and they're right here in our midst. I remember Dr. Malik telling me that I didn't know that we had that many people with alopecia around us, that until he got the letter from DIL. So I'm glad that we're having these conversations. The mental health challenges are real and we cannot continue to ignore. In terms of handling and living with mental wellness, the first thing we need to come to terms with is that for most people, the kind of alopecia they will suffer from is largely irreversible. And so there's a phase of radical acceptance of the reality of this issue, if it is irreversible. And I have to use the word radical acceptance because just regular acceptance would not suffice. You have to radically accept the reality of this condition. And that's the start. And I think that for those individuals Ms. Jasmine talked about who are still afraid of showing their heads or talking about their stories in the public, I think that for some of them, they have gotten to a certain level of acceptance, but they are not yet at the stage of radical acceptance. Having said that, I'll also be quick to add that the confidence and the boldness to share one's story is personal. And I do not fault people who do not want to share the story. But I'm emphasizing that the first step in mental wellness with respect to alopecia, in my opinion, is radical acceptance. Radical acceptance. We need to accept the reality of this condition, because until we accept the reality of the condition, I feel that the next steps are not likely to be productive. The next steps to mental wellness are not likely to be productive. So another thing that people can do to improve mental wellness is to take care of their personal, of their physical health. You have to pay attention to your physical health in terms of eating right, doing the right kinds of exercises. Because when your body, your physical body is not in the right place, your mind will not likely be in the right place. Another important thing is having connectedness with people. You need to bond with people. You need to have people who are your confidants, people that you can talk to, people who wouldn't judge you, people who provide a safe space. More than ever before, we need social connectedness, and especially with individuals who are survivors, who are heroes. Let me borrow the word from Ms. Jasmine, who are heroes of alopecia. That connectedness is important. And I like the fact that there's a support group. Support groups provide connectedness. When you have people who share similar struggles, you're going to draw from strength of people. And I think that when you have a support group that is safe and that is genuinely supportive, it can do a lot more for you than a doctor in a hospital can do. Because when people have walked the walk and have gone through a particular thing, you can draw from their experiences. You don't have to travel the route they have traveled. You can take a shorter route to your mental wellness. So I solidly encourage support groups. And I think that is something, I commend what Ms. Jasmine and our group members are doing. And I hope that many people who have similar challenges can embrace what you're doing and join you, and and just draw from one another's strength. Right. So another thing I would like that is important in promoting mental wellness for individuals with alopecia, like myself, is learning to ask for help. Because beyond the issue of the alopecia, like I mentioned earlier, there are challenges that would occur in our lives. We are not living our lives in isolation. There are other aspects to our lives that will come with challenges, and that we want to test our resilience and our reserve, our emotional reserve. So the ability to ask for help is something that is crucial. A lot of people don't know how to ask for help. They feel somebody's going to be talking about them, somebody's going to be spreading their story all over the place. And I think that that's something that we need to do away with. If you don't ask for help, nobody is going to know that you need help. So you got to learn to ask for help. I'm talking to myself as well. I'm learning to ask for help more and more, right? So when we learn to ask for help, even for seemingly little things, you just might be surprised how much support you will get from people, right? So, and then finally, I think that one of the things people need to do is to also equally recognize when they are having mental health challenges as a consequence of perhaps the alopecia or other things. And that recognition comes from realizing what the symptoms of mental health challenges look like, right? So when you're having problems with sleep, when you're having problems with your appetite, when you're having problems with social interactions, when you're having problems with concentration, when you're having problems with your mood, your energy level, those might be pointers to mental health challenges. And that's another indicator that you need to ask for help, because the earlier you recognize these things, the quicker you would be able to ask for the appropriate help and get the help. We don't want to wait until symptoms have become severe and somebody who has depression has gotten to the point of suicide, and then we want to start intervening. So the ability to recognize these symptoms early is one of the steps or key things to do to ensure mental wellness. The other things to do is that it's important that people recognize their stressors. Even though I won't be confident to say that stress in any form directly causes alopecia, but I do know that it increases the chances of poor hair growth, so to speak, and many other things that happen in our bodies. So we need to recognize what our stressors are. What are the things that test your patience? What are the things that get you irritable? What are the things that get you upset quickly and easily? And then you need to learn how to manage them. Self-mastery is important. We need to learn how to say no to certain tasks and responsibilities. We need to learn how to set boundaries to improve our mental wellness. We need to learn how to manage situations and circumstances. And finally, we need to learn how to build resilience. You know, when Ms. Jasmine was talking about some of the rude comments and caustic comments some of our classmates in the uni were making, you know, you really can't control what people say to you sometimes, right? What you can control, first of all, is how you respond to it and how much opportunity you give people to be able to get away with what they say. So that comes into play, building resilience, ability to bounce back, ability to have a right dose of self-esteem, and, you know, being able to put boundaries and being able to check people when they are crossing those boundaries are very crucial in enjoying mental wellness. I think I would also like to end on this note that reading about your condition to actually gain mastery of the condition is equally important. I was super impressed when Ms. Jasmine said she had to go online and search. Whilst I am not encouraging that we make Google our doctor, but you need information. Information is supposed to be power, right? So the right kind of information empowers you such that when you encounter negativity, when you encounter people saying stuff out of ignorance, you're able to educate them, you're able to stop them. Even though I've said the last day, a few other things just keep popping up in my brain, so please indulge me, right? So at some point, Feromi talked about positivity. So one of the things about positivity is that, look, the truth is that in life, there are negative vibes everywhere. I mean, life is just designed to throw negative vibes in your way and in your face, right? So all of us, not just individuals like me and others on this forum who are survivors, who are heroes of alopecia, but every single one of us actually need to have our positivity fuel. What fuels us every day? And we can get our daily dose of positivity by doing our own personal affirmations. And that has a good way of building self-esteem, you know. I do that myself. Like, you look yourself in the mirror and then you say positive stuff to yourself. It works magic, I can tell you. When you say it long enough, you will soon start to believe it. And it gives you the right kind of fuel to challenge the negativity that the world is going to throw at you. Because the world is just set to throw negativity at us at every single opportunity it gets. So we have to be able to affirm ourselves, to say positive stuff about ourselves. There are many individuals online who have positivity affirmations, positive affirmations. You may want to tap into them, or you want to create your individual positive affirmations, and it is super, super effective. I tell you, I use it and it does work. Another thing that helps is meditation, being present in the moment. I'm not talking about yoga as such. I'm not talking about all of those sophisticated kind of stuff. I'm talking about meditation, being present in the moment, being aware, or rather mindfulness, being aware. Meditation is a kind of mindfulness, being aware of the time T, the present moment. It just helps you to block out negative vibes that might even be coming from your immediate environment. Just being aware of your own breath, being aware of the smell of your cup of tea, just spending time to gain awareness of your environment. It's times in a day, and that helps. I think on a final note this time, I think that we should also learn to practice gratitude. In as much as that may seem difficult, gratitude helps. people keep gratitude journals, and that's something we need to practice. A lot of times we seem to think that the grass is greener on the other side. It's because sometimes we are not grateful enough for the things that are green on our side too. You know, as human beings, we just keep looking at the other person's greener field. Meanwhile, there are things in your own corner too that are equally good. So being able to pause, reflect, and express gratitude for even the seemingly little things goes a long way in helping our mental health. And whenever you think you need it, by all means, do not hesitate to ask for the help of the therapist. I think I'll stop there. Right. Thank you.
Let's just take 30 seconds to let all that sink, because I mean, it was that's thank you, Miss Adetoun. Thank you very much. Okay, 30 seconds.
Naromi, I'm right here.
Yes. Hello, ma.
Yes, I'm right here.
I mean, I just want to say thank you to Ms. Faloye for her beautiful contributions regarding the mental health parts. And then before we go to the questions, Ms. Tony, do you have anything you want to also put in?
Yes, I was going to say thank you, Dr. Tom. It's been a wonderful presentation. It's interesting that you should mention that you deal with the alopecia. Just when I was speaking with Tolulope, I was explaining to her that I deal with alopecia as well. And this goes back to when I was like age 13, the first episode. And I saw so many dermatologists. Eventually, I had to go to UCH with my mom. And, you know, we were meant to see the chief consultant there. And he was not present at the clinic that day. And my aunt, who was at UCH, who invited us over then, just took me to her place. They lived inside UCH. She just took me to her apartment and gave me some topical treatment. Now, as a pharmacist, with benefit of hindsight, I realized that it was something containing some corticosteroids. And magically, it worked, you know. And then for several years, I didn't get any such symptoms. But it did come back, and I do have episodes that keep repeating. And in more recent time, it's been also more extensive, so to say. But I find that most times when I pay attention, it grows back or whatever. But like, so sometimes it's reversible, sometimes it's not. And like you said, one has to learn to live with it. I was diagnosed a few years back, about 13 years ago, with psoriasis. So it turns out that apparently because I have some autoimmunity, I think this is why I keep having this, you know, recurring episodes of the alopecia. So sometimes it's just even getting the right diagnosis. I was also going to ask, are you looking at the aspect of talking to your colleagues, you know, that the part of it that you mentioned, the aspect you mentioned about empathy and consideration for the mental health, you know, of their patient, because sometimes you just deliver this verdict matter of factly without much concern about how it's going to affect the patient. I mean, I think long ago, I was having issues, I was having insomnia, and it was beginning to get to me because I felt like my stress levels were beginning to be quite high. I was not getting the deep sleep required for my body to rebuild, you know. And so I reached out. But I felt that consultation was so impersonal for somebody who said, I mean, I would have expected some bit of digging deeper, but all I got was a prescription. And I said to myself, I'm going to have to take care of myself and look out for myself. And I've been doing that. You know, my friends can attest to that. Sometimes social media can be healthy. At other times, it might be better to do away with it. You know, it's what I'm finding. What do you say about that? Because social media is another pressure point, you know, concerning our mental health. I'd like to hear what you have to say about that, Dr. Tom.
Okay, so that's a very relevant question, and I appreciate that. Now, I'm going to be very careful in my response. So you're absolutely correct about the fact that there's got to be some degree of emotional detachment, but that shouldn't take away from empathy. I mean, right. Okay, so, but there are some times you have to have a delicate balance. And a number of factors come into play. So it could be the personality of the physician that in question. It could be the pressure of the work at the time. It could be just an I don't care attitude. He just wants to deliver diagnosis and move on to the next patient, which is which is which is not acceptable, which is incorrect. Okay, so it's a combination of things. For some people, it's just the way they practice, and that doesn't make it right. Okay, so there are times, I must be honest, there are times that I won't exonerate myself as well. That I mean, you're just so loaded with work, and the next person that comes into your consulting room might not get the impression that you're a particularly kind doctor, might not get the impression that you're a particularly empathic doctor. That's inexcusable at the same time. But when you work in a resource limited setting, you have a little pressure, a lot of stuff going on, a lot of patients to see. Everybody's the patients are out there, they are wondering what you're still doing with one patient after 30 minutes and all of that. They are complaining out there, and you still have a lot of patient case notes in front of you. But like I said, those are not sufficient excuses not to be kind or to be empathic in your delivery of weighty diagnosis. Let's say, even if it's a delivery of malaria, you really shouldn't be very nonchalant about it anyway. You still should show some empathy for the individual. How much more when you're not delivering perhaps what will be a lifelong diagnosis? You need to find a way. There's something we call breaking bad news. There's a way you break bad news to people and make it more tolerable, more acceptable to deal with, right? So as professionals, we need to do a lot in that regard. About social media, the pressure of life and all that, I alluded to knowing our stress levels, knowing the things that stress us and how to manage them. I think I mentioned that earlier when I was speaking. And to be honest too, I mean, we need to really cut down on our social media use. It's got its advantages quite a lot. I must say that personally, I think in the last 20th, in the last 17 days or 18 days thereabout, my use of social media has declined a lot. Particularly after the Lekki Tollgate shooting, I just shut down. It was a traumatic experience for me. I shut down. I wasn't posting stuff on my handles again about mental health as often as I was doing. There were invitations I got, I almost turned down because, I just knew I had to leave social media for a while. So, but that's a level of self-awareness. The ability to recognize what's hurting you, what's not good for you at a time T is crucial in maintaining mental wellness. If you, for example, didn't understand what was stressing you out, the decision to go off social media at the time you did, you wouldn't make that kind of a decision. So self-awareness dictates that we recognize our stress levels, our stressors, and how to handle them. So
Yes. Thank you very much, Dr. Faloye. Awareness and empathy are two attributes, or rather, self-awareness and empathy are two attributes that I think even everyone should have personally. So let me direct this next question to you, Ms. Jasmine. So young
Okay.
with regards to the members of the foundation have problems with the members self-esteem, especially considering their young age. How do you help
Okay. I think the youngest Alopecian on the group at the moment is 17. And to a great extent, she understands a lot of things. We actually have minors too, but because they might not really understand what we do on the group, we decided to add their parents.
Yeah,
so we have minors from age 14 downwards. I think the youngest of them is 6. So their parents are there representing them. And from time to time, we try to check up on them to be sure that they are doing good. And we always get feedback, positive feedback, because sometimes we share pictures, we share videos, and their parents show these pictures and videos to them, there's always this excitement, you know, like, oh wow, that's Aunt Jasmine. Oh, I love her. She looks like me. I look like her. You know, there's this connection they get. There's this acceptance that comes after those files you get. And we're actually working on something for next year, like a community outreach, like it's all where we get to meet ourselves one-on-one, you know, because this whole thing should actually go beyond just meeting online. You know, I remember when I got to meet with Moshudat, we used to communicate online, but I felt we should take it beyond that level. I felt we needed to see and meet one-on-one, and my joy at that point knew no bounds, you get. So I believe when we get to meet these kids as well one-on-one and they get to see us, it's going to go a long way in helping them with their mental wellness.
Yes, yes, that's very important. That even meeting one-on-one, especially for the young ones, I feel it will even help them to like not really have role models, but yeah, like have people to look up to.
Yeah.
Just beyond the virtual world. So yes, thank you very much. Okay, so one of the questions we got, Ms. Dr. Faloye, from the Heroic Alopecian Foundation. How can I learn to love myself despite the fact that people around me are not accepting me because of my condition?
Oh, okay. I totally get that that's a difficult place to be in. But the first thing, and this is purely honest, is that the first thing that is important is self-acceptance. I know that's what you're asking, but it appears to me that the person asking this question has probably learned and grown over the years to attach their self-love to outside validation. Yes. Let me be honest with you. Many of us, particularly many of us who grew up in Nigeria, I mean, we grew up with unintentional negative comments from even our parents. Oribo sharing, can't you see, such that unconsciously children grew up not loving themselves because of negative comments from parents, from family members, from even school. And that's one thing I've learned. I tell my kids, you're outstanding, you are beautiful, you're exceptional. I mean, I consciously say that kind of thing. So I understand one of the places where this person is coming from. Perhaps you have grown up living in getting your sense of self-worth from external validation from outside. And you need to now be deliberate about getting your sense of self-acceptance, self-love from yourself first. If you do not come across as somebody who is self-assured, who loves herself, who accepts herself, there's a way we all transmit vibes to people. There's a way we unconsciously communicate how we feel about ourselves to people, and they pick it up. So to love yourself comes first from the understanding that nobody can love you if you don't love yourself first. You need to understand that. So we then move to the steps to self-love. You're going to wake up every day, look yourself in the mirror and say everything about yourself, even if you don't yet believe it, everything positive about yourself, even if you don't believe it yet. So you're going to stand in front of the mirror. You have to be practical about this, and tell yourself, I am beautiful, I am outstanding, I am excellent. I am great. I am worthy of association with people. Every positive thing you can think about until you begin to believe it, and you have to make a daily practice of it. You will see that you may need to paste it on the walls of your bathroom, in front of your wardrobe. You have to paste it where you can see these positive affirmations. What you don't believe, you cannot make other people believe about you. So you got to first of all believe it, that you are deserving of love, that you are outstanding, you are somebody people would want to associate with, that you carry something. You're going to write as many positive things as you want about yourself. Don't worry about the fact that you don't believe it yet, but you will write them down. You will stand in the mirror and say those things to yourself. You will realize that with time, you will begin to believe it. It's going to change. Your walking steps will change. The way you talk about yourself will change. When people pay you compliments, don't say, ah, it's just one clothes like that. When they say your dress is beautiful, take it with your full chest and say, yeah, thank you. It also comes with learning to accept compliments. As if sometimes when they tell you that your dress is beautiful, some of us females, we feel they are mocking us. Your dress is beautiful, take it, that your dress is beautiful. You know, so these are practical steps. They may look seemingly small, but trust me, the days I leave my house with an air of confidence, the way people treat me differs. So me, I know that one. No. Because it first of all comes from me. What you transmit to people is what they will give back to you. So self-love comes from you. Loving yourself is intentional. And you're going to say those positive things about yourself until you start believing it. And when you start believing it, it changes your behavior. There's so much power. There's something we call cognitive behavioral therapy. Our behaviors and our emotions are first influenced by the way we think. It has been established time and time again. And our belief is part of our thoughts. So once your thoughts begins to change, once your belief about yourself begins to change, it's going to affect how you feel about yourself, and it's going to affect how you behave. So self-love starts with saying the things you believe you want about yourself. You will start believing it. Then it will change how you feel about yourself, and then how you behave about yourself. It is how you behave about yourself that people will get the vibe, and then they will begin to respond in a positive way to you. But the first focus is you. Start saying those positive things about yourself, and then you will start believing it, and you start living it.
Even the little things matter. I remember one of our calls with Miss Kibon Nfi. She's a fashion designer, and then I think we're talking about dressing. Yes, to be precise. She was like, and I quote her. She said, even the little things, even if it has to do with the colors you put on your nails, or wearing high heels, or even the shirts or dress that you choose to wear that day, would really influence your mood. So, having self-confidence, self-love, love yourself first before any other person. I mean, there are a lot of people that have suffered from depression because of rejection from other people.
And I want to say thank you and reaffirm again, once again, that about, accepting what you cannot change. This radical acceptance. And like you said, rightly said, confidence, is attractive. So, I mean, sometimes it's not so much about what you have on or what, but it's just that air that attracts people. There's some certain people just naturally exude this air of confidence, and you find people flocking towards them. Everybody wants to feel good about themselves. So when you feel good about yourself, you're able to make the people around you feel good about you, and they feel good about themselves too, because everybody is just seeking positive affirmation of some kind. And when they see that you're accepting of yourself and you're just so confident about yourself, they're attracted to you and they will treat you right. So we treat ourselves the way we want to be treated. It's like Dr. Tom said, we give out the cues, whether we realize it or not, of how we want to be treated. If we want to be treated well, we just, have to carry the airs. And I love Tolulope Jasmine a mantra, fearlessly authentic. She really has embraced herself, and that makes her attractive. You just love the air about her, Feromi mentioned Kibonen. Kibonen, I listened on Kibonen's call and I fell in love with her. I just have to tell her, I said, I just love the aura around you. You exude so much confidence, so much positivity, you know, as a person. And she was just so naturally herself. And like she said, you know, being bright, you know, wearing bright colors. She understands how, you know, to surround herself with an aura that is attractive. Okay, so there's another question that Feromi has shared about depression, right? Feromi.
Yes, it's about depression.
Yeah.
Okay, let me direct this question once again to you, and then we'll then hand over the last question to Ms. Jasmine. Depression and high levels of anxiety have become my companion since I started losing my hair. What can I do to manage my mental space?
Oh, okay. So, well, one of the things when people tell me about depression is I want to be clear that what they are calling depression is what I call depression. Because I found that a lot of people use the word depression.
I don't know what it means.
Loosely.
Yeah, loosely. Depression really is not I am sad. It's not I'm feeling unhappy. Depression is a clinical diagnosis. There are things that we specifically look at for to say that a person has depression. So I really want to know what the person asking the question means by depression, because every one of us, we don't stay in a state perpetually. So we come to what we would call a period of normal mood most times during the day. But when you say depression, you're talking about extreme sadness that is persistent. It will last for days, 2 weeks, or even months. And it will be accompanied by other symptoms or other experiences, such as getting tired easily, not enjoying your hobbies, having problems with concentration, having poor appetite or excessive appetite, having poor sleep or sleeping excessively, sometimes it can come with feelings of hopelessness, feelings of guilt, feelings of worthlessness, feelings of suicide, thoughts of suicide, and the likes. For some people, it comes with reduced sexual drive and interest. So when there's a constellation of those things, then we can, and it is lasting for 2 weeks or longer, then we are talking about depression. High levels of anxiety. Again, every single one of us needs a certain level of anxiety to perform. Before I could come on this program this morning, this afternoon, before I could log on, there was a certain level of anxiety I had about how I'm going to speak, what I'm going to say. Will I make sense to these people? I mean, that's the honest truth. Each time I have to speak, those thoughts race through my mind. But it energizes and fuels me. So that's a certain kind of performance anxiety. But when you say high levels of anxiety, I'm thinking you mean that there's persistent worry, apprehension, uneasiness. Fine. So if these things are happening and they are affecting you, affecting your relationship with people, or affecting your performance in your work or your academics, I would honestly recommend that you get a therapist. So we sit down and tease out these things. Let's decide, what is this thing you are dealing with? You may think it's just the alopecia, and you may be right, but there may be other things around it, around your life, in your life, that are contributing to this, that will require some degree of extensive consultation and assessment to be able to arrive at what is best suited for you. On a general note, the things I have shared about maintaining mental wellness are beneficial. But on a specific note, I would suggest that if it is interfering with your quality of life, the way you feel about yourself and your world and everything that matters to you, I would honestly and strongly advise that you seek the help of a therapist so that they plan something that is best suited for you so that you can begin to enjoy your life, live happier, healthier, and better satisfied. Thank you.
Yeah, thank you very much, Dr. Faloye.
And I'm sure that with Asido, you can probably get support for the mental health related issues, you know, that may be coming up. Because I recollect that just a few days ago, you reached out to us, you know, and requesting help for one of your members who seemed to be, you know, suffering depression. And we reached out to Asido, which is why we actually then decided that this should actually be a joint effort, such a meeting, such that we can have an expert answer the questions, you know, directly on the platform. So thank you for the great job you're doing. And, you know, being a support group is essential. Like Dr. Faloye pointed out, you know, having someone who has walked the journey helps anybody coming, you know, behind to arrive at take a shorter route to arriving at self-acceptance and, you know, building up confidence and self-love, which are very, very important, you know, when you're dealing particularly with issues that might have to do with your self-esteem. It's been a great call. We appreciate, you know, everyone who has joined on the call. I believe that this can be an ongoing interaction because as issues come up, you know, they can be addressed. So, and everyone knows now that whether it's on the DEAL platform or Heroic Alopecian Foundation, we know that we have resource and we have, you know, we can, you know, reach out. We have people that we can reach out to and that there is a support group in existence. And thank you very much. Thank you for your time and support. Thank you, Tolu. It's been a pleasure having you on. Thank you, everyone.
Thank you.
I do hope that and believe that we have gained something this afternoon. Thank you very much.